Hair loss is a very common problem for both men and women. Many might think that men are the only ones concerned with hair loss as I speak to you. It is. However, women experience hair loss as well for a variety of different reasons. Some are transient, some are genetically predisposed, some are just due to age and timing. And so, I'm just going to talk about a couple of those. So the first thing is aging, the aging process. As women get older, the growth and shed phase don't always match up, and women may tend to lose more hair than they're growing. In addition to that, support to the hair follicles changes because of hormonal loss and menopause. Hair follicles become thinner and finer, which is why as women get older, you might see that the strand diameter is thinner and seems like every other hair just isn't there. So even though they're not losing areas of hair like men do in a male pattern, their volume is diminished significantly. Oftentimes, if it's long enough for them to tie into a ponytail, they can tell that their ponytail is thinner, and just the diameter of the hair is not as thick as it used to be. And that's one of the most common concerns that women experience, and pretty much it uniformly happens to women as they get older. Another type of hair loss that women experience is androgenic alopecia. Not all women are genetically predisposed to this condition, but it has to do with how sensitive their hair is to DHT. DHT, dihydrotestosterone, is a potent testosterone that is made in the skin, is a byproduct of testosterone metabolism. And those women that are prone to that, much of their lives, they've had thinning hair, and especially as they get older, they have more of a male pattern loss, either in the crown or in the temples or the receding hairline, the widow's peak. Now, those women have a genetic predisposition, and of course, for them, there's a variety of different therapies to sort of combat that hair loss, which is very similar to what we do for men, whether it's using finasteride or minoxidil or other preparations. But then there's an even more common type of hair loss that women experience, and it has to do with changes that can impact the hair follicle. Hair follicle is highly metabolic. It's metabolically active, which means it makes it very sensitive and susceptible to change. So major stress, major illness, hormone shifts like pregnancy, menopause, or hormone replacement therapy, or even starting new medication for a variety of other conditions, can induce hair follicles to move out of their natural phase into their very next phase of shed, which is called telogen. The telogen is a shed phase. So the telogen effluvium means an increased loss of hair. So if hair follicles move into the next phase prematurely, like many women might experience after childbirth, now they go from having 100 hairs of sheds, 100 hairs that may shed per day, to up to 200 or 300 hairs per day, which is very alarming for that person who's never experienced that problem. Oftentimes, moms that have given birth will experience that with every single pregnancy. And it's very recognizable because suddenly there's just more in the brush, there's more in the shower, and it just seems to be a very generalized loss. There's no particular area. It's not a pattern. It is just as if every other hair is being shed. The reason why we shed hair typically at about 100 hairs per day is simply because so we can have recycling of those hair follicles in a generalized way, so you don't really notice volume loss. But if you have more than the usual amount that's shedding in the telogen phase, it seems like you're losing it a lot. Well, the good news about that issue is that those that are prone can anticipate that with most changes: illness, major stress, a move, a divorce, a loss, new job, or pregnancy, or starting hormone replacement therapy. So when I see patients for hormone consultation, one of the first questions I ask them is, did they ever lose hair during their child after giving birth? And those that do, remember that it happened every single time. With every childbirth, they lost hair, but it always came back, typically 3 to 6 months later. Starts with baby hairs and eventually grows back out. But some of these phases can last up to 3 months. So for patients who have experienced that, they can anticipate that with just about any kind of abrupt change. Now, the good news about that it's transient, it will restore, it'll always come back. So patients, when they're starting hormone replacement therapy, particularly if they're starting estrogen or testosterone, they can experience this. It's not necessarily the hormone. It has everything to do with just a change. And it's transient, it usually comes back. Now, that's very different than those that have androgenic alopecia because they are prone to increased loss or sensitivity to DHT increases. So for them, we treat them very much like we do men that are losing hair. Supportive measures to improve the hair follicle lifespan and the support. But that's a very small population of women that experience them. So for the most part, when women are starting hormone replacement therapy and they experience hair loss, it's usually not because of the hormone itself. It's usually because they're prone to it, and it's going to be, and it'll usually normalize.